know that the healthcare system is broken, unfortunately.
We need to bring back ethics into the whole medicine.
When you have a why, and when a why is so deeply personal to you, then you will always find a way.
We became a system of treating symptoms instead of prevention.
I want to make Riyadh the new Davos.
Saudi Arabia, and I just feel like this is going to be the hub for the future.
Welcome to another episode of the Zenos Roundtables. I am your host, Ryann Guy, and today we are joined by Mr. Zenos himself, Mazen Karnaby, Marwan, and we also have Aija here as well. Thank you guys so much for joining us. Today we're going to be talking about the future human, tech, media, and culture. We all are kind of working in media in this space, but in different ways. And I kind of want to talk about what your why is and how you got into this space. So Mazen, of course, I've got to start with you, my friend.
Okay, so Zenos came from a passion. It came from something very personal that happened to me. And a couple of years ago, I was diagnosed with something, and I thought I had it all. Successful business, young, I thought I was invincible. But then that diagnosis kind of like shook me, and it coincided with, at the same time, that someone that we know dear, that works with us, that her son had the same thing and ended up passing away. So that really was something very emotional, because I was like, shit, I might die from this. And it led me to like really rethink my life, rethink the way I live, and started as a personal journey for me to find out solutions, how to live better, how to take care of myself better. And the idea was like, if I can, me, myself, find the solutions, I was like, why don't I share that knowledge with the world? And so Zenos came about, and it started as a supplement company. I wanted to do something where it can really work on the inside, make my body, how can optimize my body. But then I was like, supplement alone is never enough. I want more, because just I'm crazy like that. I always want bigger, better, and my brother will attest to that. And you're always like, no, chill, and I'm like, no, we chill when we die. This is when we actually build, and I want to build something. So with that, the idea of the summit is like the first piece of the information. I want the knowledge to go out there. I want to bring the brightest, the best in the world to come and teach and let our message reach the bigger, the better, the more. And this is where we at now, and it's not going to stop here. Zenos is definitely going to expand into, we're building an intelligent agent. We're building a tech platform that can actually watch and read data from people. We like through their wearables. We want to track them. We want to make sure that they're doing the right stuff, because we want to give the people the tools, the education, so they can really optimize their body. We're going to do genetic testing, because we want people to really understand what's going on with their body. We're looking into wellness longevity clinics and stuff. So we're building a whole 360 ecosystem where we can take care of you from A to Z, and we want to really democratize that. I'm not looking to have the notion that, oh, if I want to go down this road, I need to spend 50, 60, or even hundreds of thousands of dollars every year to take care of myself. I want to make it accessible. I want to make it reachable, where every person, we feel that it's, like I said in my speech, it's God-given right to have the right to eat clean food, to breathe clean air, to have the best medical advice, best medical knowledge possible for everyone. And this is my why. So I feel like this is my new role in life, and I'm happy to be doing it.
Thank you for sharing that, Mazen. And I think truly the underlying tone in all of these speeches, all of these events that we've had, is really longevity and health starts at such a basic level. I think so many people skip over the internal growth that you need to really capitalize on longevity. A lot of people are just jumping right into, the red light therapies and the hyperbaric chambers, and what tools can I have in my home to use every single day of my life, rather than doing that inner work. And a lot of the conversations have been around interpersonal skill building and in emotional mindsets and everything like that. I know, Aija, I wanted to talk to you because you shared some of your personal experiences growing up, and then you now, fast forward, Forbes 30 under 30. That's an incredible feat to have under your belt. I kind of want to know what your why is, if you can explain that.
I was sitting and listening to you, Mazen, and hearing your why is so striking to me, because it is so clear that when you have a why, and when a why is so deeply personal to you, then you will always find a way. And that impact is just so much more purpose-driven. And so I'm thinking, as you're talking, back to my why, as you mentioned, I was a kid that dealt with really, really bad bullying. I would come to school every day. My classmates would tell me to kill myself every day and that my life wasn't worth anything. I was really badly bullied for a lisp and a stutter I had, and at many points I didn't want to live anymore. But I think the thing that always got me through that period was stories. It was stories I would read, I would watch on TV, I would listen to. And my dream when I got older was to be a storyteller, to write books, TV shows, and then ultimately to make content. And as the years pass by and I start to see that, health is such a critical thing. You can't do anything in your life without your health. And when the health of a loved one isn't there, that's the only thing that you want to focus on, is to make that person you love better. It's made me very invested in wanting to go all over the world and learn about how we can live longer, healthier lives for ourselves and for the people that we love and for everyone.
That's beautiful.
Yeah, that's beautiful.
I relate a lot to that, as we were sharing earlier. I also have experienced, bullying growing up, and same thing. It's crazy that children have this type of dialogue that, kill yourself. Like, that is an insane thing. And then to be able to transition that and translate it into what we're doing today. Like, look at us, we're in Saudi Arabia. You're speaking at these conferences. We're holding these spaces for these conversations. Like, what a beautiful way that you have used that pain for purpose. And I really like to hear your why. And
Right.
Marwan, I kind of want to talk about your background as a pharmacist and how you have found yourself in this space. What is your why?
Thank you for the question, Ryan. How are you?
I'm
guys,
doing
this
well,
morning?
thank you.
So I've been in the healthcare field since 1991. Graduated in 1994. Been in the space for many, many years. We've learned a lot. We learned what worked, what doesn't work, and we all know that the healthcare system is broken, unfortunately. We became a system of treating symptoms instead of prevention. And this is why Zenos came into the picture, because we want to give people better lives. And we don't want wellness and longevity just to be accessible to the wealthy. We want to streamline it and make it accessible to everyone.
Absolutely.
And we chose Saudi Arabia to our first Zenos Health Summit, because we believe and we have the same vision as Crown Prince MBS with the Vision 2030. We're super excited, and so far the summit has been very successful.
I can tell you a little bit about my why, and I relate to what you just said, how we have a broken system. And so 2 years ago, my brother passed away from medical malpractice, and it was something that they were just treating symptoms and not trying to find the root cause. And over time, his body deteriorated. Doctors couldn't figure out what was wrong with him. And kind of fortunately, but unfortunately, of course, he did end up passing away, but he went to sleep and didn't wake up. So I'm glad that there was no final pain there. But I think it's really important for us to have these conversations and how we change, how we make the difference in health, and that is alternative health. And I just really appreciate you guys being able to hold these spaces for us to find out what we can do to make a difference. And with that,
I feel like we need to go back to meaning, like purpose. We need to have these human connections.
Yeah.
We need people to connect more. I feel that with the spread of technology and the
Yeah.
advancement, I feel like, because I have children, and I've seen them like they barely talk to their friends. Like it's all either on messages
Digital.
and stuff, and then even when they're together, they're like, oh, we have a play date. And I always tell, like, I took my son to the new Universal Park in Orlando, and he has him and his friends. Like, okay, during the park they're all happy, but then when I bring them back, and even to restaurants, they're all sitting next to each other, but no one's talking to each other. Everyone's on their devices. So I feel like it's like as humans we're losing our
Connection.
our connection. There's no
Absolutely.
more like this closeness, and it's not like, I think we need to really educate our youth,
Yeah.
really go back to the roots and have connections and stuff and rebuild
Totally.
those and give them the tools. No, put your phone away. Yes,
Exactly.
technology is here to help us
Yeah.
and help us do certain things,
Yeah.
but I don't want it to kill our humanity, and I feel like it is.
Yeah.
Like we live in this warped up world of just like tech.
Yeah.
No, I think we definitely need to go back to being human again.
Yeah. And caring about the person and not being just another patient
Yeah.
on the chart, you know?
Yeah, exactly.
Yeah.
100%.
Absolutely.
I tried this new like health scan, and they lean heavily on software and technology, but their thesis is actually really interesting, and it gives me hope for like how can we integrate technology into healthcare but maintain that human connection that you're talking about. And their thesis is that there's all this stuff that costs so much money in healthcare, which is the back end, the back office stuff,
Yeah.
right? Like all the admin stuff. What if technology and software replaces all of that, and then you actually have more time with a doctor face to face? And when we talk about like the future of health, that's what I'm really excited about, because I think we can use AI and technology to reduce the cost by replacing that, and then hopefully give more people that face to face time with healthcare practitioners.
Yeah, I
That
mean,
would be
at
ideal.
this point, you're able to kind of take pictures of whatever you've got
Yeah.
going on with you and send it into ChatGPT, and it can spit out an answer for you in 0.2 seconds. And it's really changing
By the
way
way,
that medical.
yes, Peter Crone, I believe, mentioned that you
Yeah.
can ask ChatGPT everything today.
Yeah,
And
of
it'll
course.
give you-
Yeah, he shared the story
Yeah.
about.
Yeah.
I know, but like I don't know if you saw that, like with ChatGPT though. Like I feel it's skewed in a way. Like
Of
if they
course.
don't know the answer, like I think someone was asking like what percentage of, I forgot what it was, but then they said, oh, 80% of people believe that, and then they questioned like, what is your source? Name the source. And ChatGPT couldn't give us
Yeah.
couldn't give a source.
Yeah.
I'm like, so how did you come up with that number? Oh, it just sounded right. So like
Scary.
like it's scary because
Yeah.
a lot, like I see a lot of people now walk around with just ChatGPT everything.
Yeah.
And how do we know that what's they're
Yeah.
spitting
Well, I
out?
think it's being used as a crutch rather than a tool. It's people are just relying on it 100% rather than working with it.
I mean, sadly, it's becoming the AI doctor for some people. They're doing their blood work, and then they're loading up the information on ChatGPT and asking ChatGPT what's wrong with me and how can I optimize my health based on these results. That's really what's going on today.
I do that. But I do it like in addition to working with the doctor,
Sure.
just to like have that added perspective, which I think can be
it's like
helpful.
getting a second opinion, right? Like
Yeah.
you're not gonna go if you have something really wrong with you.
Right.
You shouldn't just rely on one person to give you that answer, because there could be. What if they had a bad day today? What if they, don't like you? You walk in the door and they're like, I don't really like this person, and then nothing's wrong with you. I don't. You're fine. Go home. I
think
think
it's a-
getting a second opinion is important, and utilizing it as a tool, and also,
Yeah.
going to the expert is important.
People like that reassurance.
This podcast is powered by Zenos, supplements designed with real ingredients that actually work. No underdosing, no fillers, just real standardized compounds backed by longevity research. Try Mood Zen, Burn Zen, Cell Zen, or Gut Zen, and experience the difference that science makes.
We need to bring back ethics into stuff, into the whole medicine, into healthcare. And I feel that the biggest problem we have in healthcare, even on the pharmacy side, and it's even worse with the doctors, are the insurances. they put such restrictions and they force doctors to cut savings like as much as possible. They don't want to pay for treatments, they don't want to pay for certain drugs, and the patient get end up like not receiving the best care. And the way the system is built, especially like on like a capitation, for example, they say, okay, you're allowed a certain amount of money for a patient every year, and that involves medicine, like on the healthcare side and on the medicine, and they want them to only stick within that budget. But and they give them like say 2,000 patients a month to take care of, and doctors are churning patients. They don't have, like you said, they don't have the time to sit there and talk to patients and make sure that they're getting the right care. Like, I want to be comforted. When I go to a doctor, I want to be comforted. I want to sit there and I want him to talk to me and explain to me.
Yeah.
But I feel now, with the restrictions with insurances and how everything is being like speech, like fast tracked into like, no, 5 minutes at most they see you. Especially if you go to the dermatologist, they go, okay, there's nothing wrong with you, go home. No, like people want to sit there with their
Totally.
doctors and to talk to them. And this is what we need to, like you said, with AI needs to take care of the back end so doctors have more time to sit there with patients. And I completely agree with that, Asia.
Totally.
And
I just
Asia,
want to, correct something. It's not cut savings. What Mazen meant to say, cut expenses, because our healthcare
Yeah,
costs
expenses, Emma.
pretty high.
Sure.
Okay,
Sure.
and they keep complaining about that, but unfortunately, nobody's doing something about it.
Yeah.
So if we do a lot of prevention medicine, we can cut healthcare costs tremendously. And this is really our vision, is to give people the tools they need for better healthcare outcomes.
And so since people aren't really doing anything about it, how does something like this for you, Aija, where you have such an influence on social media, such a presence, what can you do or what do you do to kind of change the narrative or at least educate people on better health?
It's a good question. I think for me, what opened my eyes was I took care of my uncle, like, oh, wow, this was maybe 7 years ago now, as he was dying in the hospital. And the treatment he received, especially being an elderly person, was so horrific. It was like this person was already dead. And they just kept amputating limbs based on where his infection was spreading.
Wow.
And he was, going to die anyway. And it was just such bad treatment. And I started thinking, especially for older people, and we're all going to get old, hopefully, there just needs to be better care. And so I became an Eisenhower Fellow. I spent 3 months in Asia, in Singapore, Japan, Korea, where there are very long lifespans. And I started to study what is working here. Is their care different? Is their technology different? And then making videos about it. And those videos seem to really resonate with people because what I found is that, yes, there are some overall structural differences in their healthcare system that maybe we don't have in the US, but it was also individuals who are really dedicating their life to figuring out solutions for different ailments and conditions. And so my goal was really just to share these in hopes that, maybe a distributor in the US will do a partnership or someone will find a solution to their loved one's cancer. And that's kind of where my work in that space has started, and trying to just amplify, hopefully, solutions
You're
to make it better.
planting good seeds for people. That's
Hopefully,
what you're doing.
trying.
You are.
No, I love
You
that.
are.
Listen, if we have the reach, I think it's our responsibility to really give it back and educate people.
We should all have a purpose in life.
Absolutely.
We should all have a purpose.
Absolutely. Is authenticity becoming the new marketing buzzword?
I think probably it has been, but I think it's just like a very natural reaction to the fact that we like to relate to people. Like when you shared your story of this diagnosis that you had, I instantly am just like pulled into your story and I'm like, oh wow, everything you've built makes so much sense now and I want to hear more. When you share about your brother's passing, the same thing happens, right? So I think we just like vulnerability and honesty in people because we feel closer to them.
Sure.
That's when your soul opens up, when
Exactly.
you actually tell people.
Today's episode is brought to you by Zenos, the science-backed longevity brand that is redefining what modern health can look like. Every formula is built with clinical doses, standardized extracts, and real research, not the fairy dust you see in most supplements. From mood and metabolism support to cellular and gut health, Zenos blends ancient compounds with cutting-edge clinical science. If you care about living longer, living better, you'll want to explore what real formulation looks like. Learn more at zenoshealth.com.
So we're talking about community and what health looks like throughout different cultures. And sitting at this table, we have a lot of different cultures here. And I kind of want to see what your experience is. I know you said that you have done some work in other countries, and tell me what it looks like in comparison to the States and what your experience is.
So I think I've spent a lot of time in Asia, and I think that in Asia, people grow old more as a community than individually. And I feel like it's probably the same here in the Middle East. You could
Yes,
speak
it
better
is.
to that,
Yeah.
yeah. And I think that's something we're really missing in the US. Is like we disregard elders. We kind of treat them as they're at the margins of society and they're no longer relevant, which is, terrible for your mental and physical well-being. But also, there isn't that like community
Care,
care,
yeah.
reliance, and so, yeah, I think there's a lot of work to be done in that.
It's like you have to make an appointment with your friends to come see that.
Yes.
Exactly.
I don't like that. Like
Exactly.
us in Lebanon, we grew up like they just knock on your door, you open the door, they're there, you welcome them, you put food. And
Yes.
it's never planned. It's like never planned. And I feel in the U.S. everything is planned.
I saw something that was like, imagine if all of social media shut down at 5 p.m. and we actually had to like go out and see each other.
That's a great idea.
I love
If I
that.
was a governor or someone,
That's what we're doing.
I'll
I
do
love
that.
that.
Honestly, because we need that.
Yeah, of
Yeah.
course. I mean, we're all just, we get off of our 9 to 5, we go straight home on our phones. We're like, even in the car ride, we're listening to something, we're scrolling on social media. We are just so drained
Yeah.
by constantly exposing ourselves to a digital device.
Yeah, like
It's so
talking
unfortunate.
about my children, it's like they constant need
Yeah.
like they can never sit down and watch a whole movie. Like I beg
Attention
my kids.
spans.
No, like
Ugh.
because they're so used to like
Yeah.
like flicking up, swiping up, and they cannot concentrate if the movie if the clip is not 30 seconds long, they don't want to see it, which is bad. Like their attention span is like
Crazy.
completely gone.
And going back to the cultural differences, Marwan, can you kind of touch on what it looks like here in Saudi Arabia, in the Middle East, versus your experience working in the States?
I mean, in the Middle East region, obviously, everybody respects, family is very important for them, and the culture is completely different. They're very close-knit to each other, and they love, talking to each other more. The hospitality is better. They're huge on hospitality. They try to make everyone feel welcome. They're very easy to talk to. You can connect to people a lot faster and bond with them. Compared to the United States, as my brother said before, like you have to pretty much plan everything ahead. It's not spontaneous. And I feel that's a big setback.
One thing that I've noticed being here, this is my first time in Saudi Arabia, and I'm from New Jersey, live in Miami right now, and it's really interesting to see the narrative that we're fed over there about this region. And when I come here, I've been here now for 5 days, I have everyone who walks past me speaks to me. They say, "Hi, how are you doing? Can I do anything for you?" They're so welcoming. We're driving around at 1, 2 o'clock in the morning after the nighttime events, which by the way are killer. And people are out and just
You can
hanging
literally
out.
knock the door of someone's home at 2 a.m. and they'll still welcome you.
And they'll answer.
Yeah.
I feel so safe here that how many times I've left my bag at the table. I'm walking around here by
No one- yeah, no
myself.
one touches
Yeah.
anything.
Everything is so clean. I mean,
And-
it is
In the U.S. and other parts of the world, they'd be like, "What's wrong with you? Are you weird?"
I know. Exactly.
No, see, like to go back to your point with the narrative, like it's sad to say, like they associate this part of the world as like backwards, evil, like and all that stuff. Yes, there's certain seeds of the population that have done bad things, right? But it doesn't paint, should not paint the whole region in that brush, right? We like, and that's why now like my mission also is like when I bring people like you and all the big
Yeah.
speakers and all people from the US, I want them to know what the Middle East is. I
Yes.
want them to experience what the Middle East
Yeah.
because
Give them a
we are-
clearer picture.
And not
Yeah,
be
about the
fearful of
region.
it.
No,
not
and
be
not be
fearful. There's
fearful.
nothing to be scared
No,
of.
it's
Trust
beautiful,
me.
like you said.
I'm
two
a
in the
little white
morning.
girl over here.
Yesterday-
Blonde hair, blue
yeah.
eyes. We're fine. Everything's great.
On the way back, do you see how many people were out around this
I
area?
that's
Like,
exactly what I meant. I mean,
Yeah.
there are tons of people. Every table is filled. It's 2:00 in the morning, and they're just sitting, hanging out. Families walking around, children
Exactly.
even.
And no
like-
one fights with each other.
No.
They don't go out to fight. There's no bar fights. There's no like evil. No,
yeah, no
honestly,
alcohol to
No,
enhance
really.
that.
There's
either.
so much to learn from.
I
Yeah.
know. Like
So
we should.
much.
Like that's why like people from the West should come and like
100%.
really experience the
A
Middle
lot
East.
of our speakers
Totally.
were completely surprised and, you know, thrilled to see how hospitable everybody is here.
Yeah.
And they already connected with so many people, and they got invited even to a lot of their homes. That's how hospitable people are here in the Middle East.
So going to that point where people are afraid, like when because we dealt with the back, like on the back end of it, we're booking people's flights and all that stuff, and the request like, is it safe? How is it to be a woman?
Yeah.
What like all that?
Yeah.
I'm like, are you guys like?
On me on TikTok,
Yeah.
like
I'm
trying
like,
to find
honestly,
everything
like,
about it.
where you guys you think you're going to? Like this
It's- we have been
it's one of the
fed such a
safest countries
narrative.
in the world
Yeah.
around here, like Qatar, Saudi,
Yeah.
like Dubai, like this.
We
like
would
you can
love
literally,
everyone
like,
to
it's the
come
leader in the
safest.
world.
Yes,
See,
I
Yeah.
know.
the
It's
See it
crazy
for
stuff.
yourself.
You have
See
to
it for
see- I can
yourself.
show you the emails we've gotten.
Oh,
like,
I'm sure.
it's crazy stuff.
But when you reached out to me, I immediately responded because I was like, health, Saudi Arabia, I'm in. Because I had never been here before, but I've always dreamed of coming. My parents have too, which is why I brought them. And they've been absolutely soaking up every moment of the summit. But, you know, I think like Saudi Arabia has had so much focus and investment, as you know, in, you know, whether it be health or, you know, so many areas. And I just feel like this is going to be the hub for the future.
100%.
And like everyone from the US, come here.
Yeah.
Like leave your biases, whatever you have in your head behind.
And just come.
Come.
We couldn't agree more.
Yeah, and I'm like the behind Zenos. The idea is I want to make Riyadh the new Davos. I
love that.
I like the Davos of health. Let them have their economic forum. They can have that, but I want Riyadh to be the new Davos of health. I want everyone to come here, experience what
Yeah.
this country's about. And to your point, yes, it will be the
Totally.
biotech hub, the hospital hub and healthcare and longevity.
Yeah.
Everything's happening here.
Yeah.
This is the future. Here is the future, and I'm so
Absolutely.
proud that I was able to do this, me and my brother, and to bring you all guys here to experience what this country is all about. And this is just the beginning. I promise you that we're gonna do amazing things here. So
Inshallah.
Inshallah. And you guys, I just want to give you another shout out because you really are the first Americans that I have met that have really seen that potential and that hub and have been like, we're making it a mission to make this incredible health summit here. Being the first, you're the first
Thank
longevity and biohacking summit in the Middle
Yeah.
East. Huge. And I just think like, you know, to add on to what everyone is saying, as I walk around Saudi Arabia, the level of quality in everything from
everything's like
beyond. And
Class.
I'm thinking like, I don't think it's possible to bring that to the U.S. unfortunately, but there's so much to
It would
learn
take
from
a
the
long
expertise,
time,
the
I
quality, the precision. I'm just blown away.
yeah, we should
Yeah.
let people just come and experience it for themselves and not
Absolutely.
listen to what the media narrative is.
Yeah.
Like, you know, like they don't right away they associate it with like killing and stuff, but it's
Yeah,
not. It's
not
like
at all.
completely different.
No,
Yeah.
absolutely. And I want to kind of get a takeaway from each of you from this conversation. If you could leave the audience with one thing, what would that be? I'll start with you.
Oh no, I need a minute. To leave the audience with one thing from our conversation.
Yes. Yeah, we talked.
I want to say from our conversation and from the Zenos Health Summit in
Of
general,
course.
The answers you're looking for, particularly when it comes to health, are not going to be found in your small radius where you live, wherever that is. So go out into the world, find the new opportunities, especially in this part of the world, and just show up and listen and leave the baggage behind.
And Mazen, I would love to hear a takeaway from Mr. Zenos Health himself.
Okay, I want people to take away from this is that there are possibilities. There are the tools out there. They just need to be open to accept these changes in their life, accept these different guidelines that we're putting out to them, and understand that they can make better choices with their life. Like even by tweaking certain things, right? Like sitting outside in the sun. Don't be afraid of the sun. Don't be afraid of eating different food that you think might hurt you. No, like make sure that you understand completely what your health needs and what you need as a person. Make new relationships. Like I said, let every conversation start something in you that you want to follow up on. Like meet a new friend, come here, and if you meet someone from Saudi or if you're from the US, understand them, understand each other. Try to bridge that gap
Bridge
where
the gap, yeah,
definitely bridge the
absolutely.
gap where we're not different at the end of the day. We are humans together.
We all truly have a lot of the same desires, same wants, same needs. We want to live healthier. We want to live better. And it's unfortunate that, we all have these vessels that we're walking around in the world, and people tend to kind of judge that off the bat. But if you really sit down and you have these conversations with so many different people of all different backgrounds, we all are kind of truly on the same page. And it's a beautiful thing to be able to peel back those layers and get to the real community of longevity and health. And so, Marwan, could you leave us off with one little takeaway from this
I want to say
conversation?
life is precious, and treat your bodies as a holy temple. It's a beautiful gift from God. So please, we would love everybody to educate themselves and make sure they take care of their bodies in a way where it's sacred and live a fulfilling life.
Thank you so much. Thank you guys for all joining us. It was a
Thank you,
lovely
Ryan.
conversation.
Thank you, Ryan.
And thank you for tuning in for another episode of Zenos Roundtables.